Mr. Steve Schell, who is the Vice President of Behavioral Health and Addiction at the Stacy Mathewson Behavioral Health and Addiction Institute. And he's from Reno, Nevada, and works with the mayor, and has also been involved in Hopeful Cities in Reno. Thank you for being here with us today.
Hello, everyone. And just in case you may not be aware, Reno is not near Las Vegas. We're 8 hours north of Las Vegas, and it's the biggest little city in America, but now the first hopeful city in the country. So I am very honored to be here on this International Day of Hope to bring global awareness to what hope can do for all of us. I would like to thank Zoya and Walmart, Catherine, Scott Mandel, and the Shine Company for inviting me, as I'm inspired by the phenomenal work they do every day. Some of you may know that Reno Mayor Hillary Sheevey proudly proclaimed Reno as the first hopeful city in the country last year. Mayor Sheevey and Catherine helped to start a community conversation about hope that encouraged me to look at what we should be doing in healthcare, as I will share in a moment. What a great day to be here with all of you to talk about hope, a term that we cannot take lightly. We all have our own journeys in life in one form or another, but hope is one common thread that can bind us all together. Too many people around the world are experiencing hopelessness that leads to depression and anxiety, and we know that hopelessness is the single consistent predictor of suicide. Before the COVID-19 pandemic started in early 2020, we were already seeing an alarming increase in the number of children, adolescents, and adults ending up in our emergency rooms, urgent care clinics, and primary care clinics with a variety of behavioral health issues. 3 years later, we are at an all-time high of adolescents and young adults aged 18 to 24 attempting and completing suicide. The Hopeful Minds curriculum that teaches all ages how to focus on hope and positivity is more critical than ever, and I believe it can and will save lives. The COVID pandemic brought the subject of mental health to the forefront, as the conversation about mental health has never been stronger than now, although we still have a lot of work to do. It is time for mental health and physical health to be treated equally, as mental health is health, and mental health matters. Suicide prevention has been the focus of my career for over 30 years. I have worked in the behavioral health field in all areas of the United States, in both inpatient and outpatient settings that include a variety of treatment programs for mental health and addiction. I have also been very involved with the National Alliance on Mental Illness and many other organizations that are focused on advocacy and prevention. While we have certainly reduced a lot of the stigma around mental health through the years, we still have so many people who are uncomfortable or unwilling to seek treatment when it is necessary, and many do not even know where or how to seek help. What I believe has been missing in healthcare, particularly in the behavioral health arena, is a focus on hope and how to assist our patients with the tools to reduce or eliminate hopelessness. I am encouraged by the fact that hope is teachable, as I believe we need to focus more on incorporating the concept of hope into the curriculums for our treatment programs. For the behavioral health programs I oversee in Nevada, we have started to introduce patients to the Hopeful Minds curriculum by helping them understand what hopelessness means and how to maintain a more hopeful and positive outlook on life. My vision for the Campaign on Hope is to also target urgent care and primary care clinics and introduce patients to hope during those visits. We know that many individuals who have mental health or addiction challenges will be seen by their primary care physician before they realize they need to see a psychiatrist or therapist. I think it is critical that all healthcare professionals, not just those who work in behavioral health, become more aware of the science of hope and how it is teachable and can benefit their patients in both the short term and the long term. We have to meet patients where they are in order to make them aware of what they can do to develop and maintain a more hopeful mindset, which we know will have a positive impact on their health outcomes. Mental health treatment has its roots in medical pathology, but we have seen a transition into more positive traits, such as instilling hope and giving patients the tools they need to better cope with the many surprises and challenges of everyday life. I encourage healthcare professionals and so many others to look at the science and research of hope and what it means for patient care. We have to instill hopeful minds on a grander stage, on a global scale, as hope has never been more important for the adversities our world continues to face. Together, it is possible to make the world a more hopeful place to live. Thank you.